When you've had shoulder replacement surgery, especially reverse shoulders, one of the big knocks on a reverse shoulder is that it's difficult to get behind your back. Now, that used to be implant related, meaning that the geometry of the implant would make it so it was difficult for the shoulder to actually make this move right here. And so one of the knocks on the reverse was that yes, it's great for pain relief. Yes, it's great for restoring this motion, but people suffer with internal rotation. Well, as we have evolved with reverse shoulders, we've designed the implants in a way that allow this motion to occur. And it is a mind-body connection, right, that needs to be retrained because when you flip the ball and socket of your shoulder, you're changing the way that your brain connects to your shoulder and how all those muscles help you move your arm in space. So after about 6 weeks, what I want you to start doing when you've had a reverse shoulder, especially anatomics, it's not as much of a problem, but with reverse shoulders, what you do, it's called the whip. So you're going to start swinging your arm. You can do this sitting or standing. And as you reach this apex here, I want you to crack it behind your back. Now, initially, what you'll do is just maybe go to like your pocket right here, even if you're doing it aggressively. But over time, what you'll see is you'll be able to go higher and higher up your back. And initially, what you see with patients is you say, try to reach behind your back. And they kind of do this very slow motion and they kind of get to their hip sometimes. And then when they do it dynamically, meaning they start to swing their elbow and really, really swing it, and then they crack it, they'll get at least 6 inches to a foot higher up their back, meaning, this is slow and then dynamic is here. And by training that over and over again, what happens is they reconnect their body, the connection of their mind to their shoulder to retrain this motion because the shoulder can do it. I mean, I've seen hundreds, hundreds and hundreds of patients that are able to get all the way up their back after getting a reverse. And what you see is they do it dynamically, right? And then over time, I mean, you're not going to have to do this big whip. You'll just do it naturally. It'll happen without you thinking about it. But at 6 weeks, I want you to start training this motion, 2, 3 times a day. I want you to spend 3 or 4 minutes. Just slight uncomfort is okay. So 2 or 3 out of 10. And I want you to swing your arm and I want you to crack the whip. See right here, we're going to swing the arm and we're going to crack the whip. We're going to do sets of 10 to 20 of these a couple times a day. And if you do that for several months, you'll see that you'll go from here to here to here to here. And by 6 months out, you'll essentially retrain and regain almost the full internal rotation behind your back. So with modern reverse shoulders, that is no longer a problem to get internal rotation up behind the back. I would say that especially our patients who train that motion, at least 95% of them are able to regain functional internal rotation behind the back, so where they don't miss a beat and they love their shoulder. Every shoulder problem is unique. Make sure that you come in and see a shoulder specialist so we can figure out exactly what the problem is and design a treatment program that fits you.